All right, boss, it's on you.
Good evening, everybody. I just wanted to take the moment to welcome you all to kind of our introduction to the Western chapter. We want to make sure that you all know who we are and see how we can support you in your endeavors of your local chapter. So I think we will start with a moment for mission. Delano, do you want to talk about your moment for mission that you said earlier yesterday, I believe?
Actually, I think Dr. Cecil has a really cool one,
Okay.
but she's going to talk about why we do the moment for mission and what it is first.
Okay, perfect.
All right. Good evening, everyone. I am Renee Cecil. I am your president-elect of Kentucky Nurses Association. We do a moment for mission at every meeting, and it's a very intentional pause for us to kind of reconnect with our purpose, right? There's always a reason that we became a nurse. And so this moment allows us not only to think about our purpose, but also why KNA exists and who we serve, which is all of our nurses in Kentucky. 93,000, right, Delaware? Yeah.
That's correct.
So it really reminds us that nursing is more than just a role or a job title, right? It's really our commitment to our patients, our communities, as well as the profession across Kentucky, right? We were just, again, nominated for being the most trusting profession. So we usually take this moment just to reflect whether you have a story or you tie something in that just kind of gives us a little bit of pause and kind of gives us our why. So I was going to reflect on this week was Martin Luther King Jr. Day on Monday. And Martin Luther King often spoke about service, justice, and that collective responsibility. And all of those values really align with nursing and the mission of Kentucky Nurses. And of course, we serve the most vulnerable, with the populations, right? And at their most vulnerable moments. And so we exist to really support you doing the work that you do, whether it's at bedside or in the classroom, in leadership, or if you're in the community. And Dr. King always tried to challenge systems that created inequity. And we do that every day, right? We advocate for safe staffing, access to care. We advocate for policies that protect patients as well as our profession. And so we, as Kentucky nurses, are that advocacy, and together it makes us stronger. And so Dr. King always reminded us, or does remind us, that meaningful change happens when people come together. And that's exactly why you guys are here. So as I end this, I just want you guys to think about how your voice could make a difference. If you stepped in, maybe got more involved with your chapter or with Kentucky Nurses Association, just to kind of take that moment to reflect there. So that's all I have. Thank you.
Thank
Thank
you.
you, Dr. Cecil. That was really nice. So I think we might get started with like a brief overview of the KNA. And Dr. Ray, may I?
Sure, absolutely.
Okay, thank you. By the way, well, unless you want to do introductions first, Cecil.
Me go first.
Okay.
Again, I'm Renee. I am your president-elect. I live in Louisville, Kentucky, and I have been involved in KNA in many different areas. I've been in nominations and elections. I've been in special events, helping to coordinate our conference that we have every year, as well as our gala, which has been very, very exciting and growing, as well as so I've been our chapter president as well, our chair, and now currently in the president-elect role. So glad you guys are here.
I'm Delano Manson. I'm looking at the squares here. I'm Delano Manson. I am the CEO for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. And I have been with the KNA 8 years. I'm also a retired naval officer, so I'm a through and through nurse. Sherry, you want to go next?
Hi, I'm Sherry Chandler, Membership Manager with Kentucky Nurses Association, and I have been with the organization for 5 years now as of yesterday. So proud to be a part of this organization and representing all of the nurses at Kentucky. Thank you for being here.
5 years, that's a long time. Roger, you're next on my squares.
Perfect. I am Roger Cecil. I am the chair of the River City chapter. I've been involved with KNA for about 5 years now, I think. It's not been a very long time. I've been a longer time member of another professional organization. And
And that
yes,
counts, Roger. That counts.
so I've been a long time member of the ENA, of the Emergency Nurse Association. And yes, Dr. Renee Cecil is my boss.
I was getting ready to say, like, who's your boss?
That's funny. Dr. Dina Hill, would you introduce yourself?
I sure would. And it's Dinah. I know you had
Dinah.
Dr.
Okay,
Byers
fine.
is a Dina, I think, and I'm a Dinah.
Okay,
Mom
Dinah
didn't
and a
spell my
Dina.
name with an H, so
Okay.
how I tell my students to remember is the old song Dinah, won't you blow your horn? So that'll help you guys remember on mine. But I have been a nurse since 1997. I currently teach at Nightingale College, which is an online college through actually our main campus we don't really have a main campus, but our office is in Salt Lake City, Utah. So I work online at home. I've been here about 2.5 years. And before that, I taught at WGU for about 10 years.
Okay.
So a little about me. And I live in Western Kentucky, in Marion, a little town in Western Kentucky.
We know it. Welcome.
Thank you.
Kristen?
Yes, Kristen Reed, part of the Western part of the state. I teach at Murray State University.
Ooh.
I've been a Kentucky nurse for almost 22 years. So Dean Byers is my boss. So thank you for having me.
We love the Dean. Okay, Dean, your turn.
Well, hello, everyone. Dinah, I think it's so interesting that you spell your name that way. I tell people Tina Dina. So with a T, Tina Dina. And I'm actually from Fredonia, so I know Marion very well.
Really? You teach at Murray
yes.
State, right?
Yes. So I'm the
Okay.
dean of the School of Nursing and Health Professions at Murray State, and been a nurse since 1999, and been a part of the Western chapter of KNA since 2004. And just to put it out there, we've struggled a little bit. So I'm so glad that we're here, and I'm glad Kristen's joining us, and we'll see what we can do tonight.
I love it. Hey, boss, you're next on the squares.
All right. My name is Joanne Ray, and my day job is I'm a director of patient care at Norton Hospital and the Magnet program director there as well. We're working on our first magnet designation. And like I always say, the job I don't get paid for is I am honored to be the president of the Kentucky Nurses Association.
It's another full-time job she's trying to get.
Which is another full-time job.
Bailey? Thank you, boss. I'm glad you're here. Bailey, you want to introduce yourself?
Hi, my name is Bailey. I'm a nursing student at JCTC, and I am in my second semester. I'm also a nurse extern at U of L Hospital. I started back this summer, and I got certified in that. And yeah,
That's wonderful.
thank you.
Okay. And Peyton, would you introduce yourself? If you can turn on your mic. Those mics are kind of touchy. Well, Peyton, if you get to the space where you can turn on your mic, we'll just stop and let you introduce yourself. How about that? Well, no answer is a yes to me. Okay. We've done our introductions. And Joanne, did you want to talk about KNA, KNF, and KNAC, and the KNE, or do you want to
I sure can.
Okay, go.
All right, I'll just give you all a quick brief history on the Kentucky Nurses Association. It was established in 1906. I can't believe that. We are on our 20th year this year of having the Kentucky Nurses Association, and we are the only full service organization in the state that represents the entire nursing profession, over 93,000 nurses. Whether you are a member or not, we will still represent you. We are the voice, whether it be in Frankfurt, state agencies, boardrooms, hospitals, and any other healthcare facility. Wherever a nurse works, that's where we represent. Whether that's a school nurse, a clinic, home health, long-term care, we will represent anyone and everyone that is a nurse in the state of Kentucky. So
To go along with that, I just want to say that everything that we do, everything, it impacts every nurse as well. Not only are we the voice, but when we do it, it impacts everyone. A good example is the prevention of nurse suicide mandatory education. We worked with the Board of Nursing to ask them if they would make it mandatory because of our data of nurses in the state of Kentucky dying by suicide. They said, yes, every nurse in the state was required to take it. When we got the bill passed on decriminalization for human medical errors. It impacted not only nurses this time, but every healthcare provider in the state. That's how broad perspective we are. We're the ones now. We're the ones. Oh, sorry, boss. Go ahead.
No apologies. You jump in anytime. You know, we always tag team this anyway.
Well, that's true. That's true. We're really good at that too.
The next arm of the Kentucky Nurses Association enterprise is the KNAC, which stands for the Kentucky Nurse Action Coalition. And that umbrella is the advocacy umbrella. So they work on advocacy. And then the last one is the Kentucky Nurses Foundation. And that's our philanthropic umbrella. That's where we raise money for scholarships and different activities within that arm of the Kentucky Nurses Association enterprise. The Kentucky Nurses Association's vision is to be the voice for nurses and work for a healthier Kentucky. Our mission is to advocate for engaging with and advancing the professional practice of nursing through leadership development, evidence-based practice, education, research, and membership. And then, of course, we always have core values, and our core values are diversity and inclusion, high ethical standards, lifelong learning, accountability, and stewardship. Does anybody have any questions about the KNA and the brief history?
Our anniversary is September, so expect things to start heating up
That's
for
right.
September. Okay, I just want to let you know we're talking about.
We have a date in September. What our actual date is, or
you haven't told me yet. But okay. I did research, and research said they didn't have a lot to share, but they had the month 06, September 1906. Can you imagine what was going on at that time? Oh,
well,
my.
we'll just celebrate the whole month.
There you go. That's the way we do it for Nurses Month. We celebrate the whole month, right?
Yep.
Yeah, because a week isn't enough. And
That's
so
right.
certainly a day won't be enough for the anniversary for 120 years. You know, if it hadn't been for the KNA, there would be no KBN. It was the KNA that said we needed to have structured licensure and an organization should manage that. If it were not for the KNA, there would be no Kentucky League of Nursing. We did that too. We said that there should be structured learning for nurses in the state of Kentucky. That was KNA. If you're getting the impression that KNA is the backbone of the profession in the state of Kentucky, you got the right impression. That's the right impression. Okay, now back to the fun stuff. We wanted to have this meeting, as the dean said, Western chapter, you have a lot of people in your chapter, almost 80 people, but you've been struggling to come together and get moving. We have, and we're going to show you some more pictures as we go through, but we have 11 chapters and 2 special nurse practice interest groups, special nurse interest practice groups, one for LGBTQ plus, and the other one is for school nurses. And those special practice groups include people all throughout the state. So it's not geographical, whereas the chapters are geographically designed. Okay, so Western chapter has about 80. Sherry, am I right? 80? Sherry's the numbers lady.
I think it's more like 140.
Oh, sorry. You guys have 140 members. So with 140 members, you could do some great things. And we were going to talk a little bit about what chapter leaders do and then some of the things that other chapters are doing that you might be interested in thinking about. The whole idea behind us having this meeting was to see if we could help you get engaged to do the great things that chapters do. And if we need to have chapter meetings with you again, we'll be glad to do that too. But you've got 140 members in this area. You could do some great things. So I'm going to ask Mr. Cecil, who is the chapter chair for River City. Now, I have to tell you, they've got 650 members, right? So they've got a lot of muscle there. But in reality, they've got about 30 people that do the work, right? But they have people who belong, and sometimes they show up to events, but not 600 of them. But anyway, Roger, could you tell us a little bit about your chapter and some of the things that you've been doing in the River City area?
Yeah, so like Delaware said, you know, we have a lot of nurses here in the Louisville area, which is the River City chapter, our footprint. And not only do we have like our normal chapter meetings, but we do other community engagements. So, for instance, last year we got involved with the Family Scholar House, which is a program where families who are kind of in interim residency, they help grow the families and get people into jobs. And so we did Halloween, so we were engaged with the families, the kids. We've done several nursing, more focused events with them. We had a nursing panel. We've got upcoming where we're going to do some interview skills and some resume building with those individuals, right? So as they're completing their nursing education, we're trying to help really get them fast forwarded into the workforce. So we have a huge presence with the annual 5K. So the 5K coming up in September, our anniversary. You know, we do a lot of work with the 5K. We do a lot of work with both nursing schools, just kind of, you know, highlighting what is the KNA, what is the our mission, and what would those students get from us, right? Because we do have student memberships. That's key for us because, you know, as you guys know who are students, you know, you're going to graduate, you're going to become nurses, and we want you to be, you know, continue to be engaged with the KNA. We also are involved with the Nightingale tributes. If you guys are not aware of what a Nightingale tribute is, whenever a nurse from the state of Kentucky passes, the KNA will come in and we have a small, you know, ceremony that we do for the loss of that nurse. And in fact, one of my grandmothers, when she passed several years ago, I did the tribute for her. It was, yeah, it didn't go as planned. I was like, I got my emotions in check, and then they weren't, and then they were again. So it's fine. So, but yeah, but you know, it's not just I have another KNA meeting or it's just, you know, what is KNA? I mean, we're really involved with the community, with our schools, yeah, and with our, you know, nurses in general. And then
Well, thank
Dr.
you, Roger.
Cecil, aka my boss, put a comment in the chat.
It's only to you, so there you go.
Oh my gosh. What
Love
was it?
letters in the chat, really, guys.
Oh, that's right. Future Healers. Yeah. Renee was involved with Future Healers, which is actually school age kids. So middle school, I think they weren't high school yet. They were young kids, but they were young kids who have an interest in the medical field, whether it's nursing, whatever, and did some events with them as well. So we do a lot of online webinars. So for CEs, and this is not just River City, right? This is across the state, but we have our next webinar is next week on the 20th. I'm getting yeses. Perfect. I have the date right at noon. It is on the IPASS patient handoff report. So,
You know, Roger, you guys do a lot of things. And you set examples for other chapters. But just to give you a few ideas of what some of the other chapters have done, one chapter does NCLEX reviews. They do an NCLEX bowl. We have another chapter that every winter they do a coat drive for the students in the schools. In fact, they do quarterly meetings and they invite their EMTs and their psych techs and their pharmacy techs to come and participate in their meetings and their education programs. So many of our chapters do activities. Let me tell you about something else that they did in River City. And the only reason that's high in my mind is we did hepatitis vaccines. We went to restaurants and we gave them to the staff. We were the traveling vaccine team. And I think we did something like 300 of them. In fact, Roger, that might have been before you came, but I tell you, we were busy. Also, the KNA did 100. Well, we facilitated the vaccination clinic in Louisville. It was the first drive-through vaccination clinic in the United States. Drive-through indoor vaccination COVID clinic. And we vaccinated over 130,000 people. Then we took that on the road and we did 30,000 vaccinations for COVID. We went to churches, synagogues, we had 3 cathedrals. We went wherever the people were because we were concerned that they wouldn't come to us. So we just said, that's okay. We'll come to you. What I'm saying is that we've come up with things that we could see that the community needed, and we participated. I was also the EndNote speaker for the Central High School health careers, and majority of those, there were 50 of them that just graduated, and they want to be nurses and doctors, but the EndNote was, well, they're going to be nurses because the only people who were at their graduation were nurses and nurse leaders. So we were really tilting the scale to become nurses. So why don't we talk about, Sherry, do you want to talk
Eleanor, I
about?
just want to add one thing that, and I don't remember which chapter did this, but I really thought it was amazing. They did Wreaths Across America where they
Oh yeah, Nightingale.
And that is something that I have wanted to do in the River City chapter, and I just haven't. I mean, Zachary Taylor, we can do it. I just haven't been able to bring that to fruition. So if you have a veteran cemetery, I'm sure that you could volunteer to do that, and that is very humbling. And of course, it's the coldest day of the year.
Of course it is, Joanne. And you know, the first day that I went, I mean, I just had to go, being retired military. But you know what? I decided that maybe I don't have to go if it's going to be the coldest day of the year again, right? Maybe I don't have to go. But yeah, that it is an incredible, humbling experience that Wreaths Across America. So Sherry, would you like to go ahead and talk a little bit about education and professional growth? And then I'm going to ask Renee to do her special thing.
I just wanted to touch base on our education and professional growth with the Kentucky Nurses Association. We do offer continuing education on demand. It's just a convenient way to take courses anytime, 24/7, CE hours from home or on your own schedule. Covers a wide range of clinicals, leadership, and professional topics. You can also obtain CEs live and virtual through our chapters. I think Dr. Cecil touched on that his chapter does CEs. So our chapters, not all of them, but do CE programs monthly or quarterly. It's a good opportunity for nurses in your region. We do offer members a discount, $25 versus $40 non-members. Leadership development, we have boards. We have 3 boards, which Dr. Ray talked about, the KNA, KNF, and the KNAC. We have 7 committees. It's a great way to get involved and build leadership experience. We also have 3 cabinets, and then Eleanor spoke about our special interest groups, school nurses, and the LGBTQ+. And also, I think Dr. Cecil touched on this, but we offer, we have student resources, an honor cord program. Our student membership is free, and all the resources that we offer our nurse members, they receive as well. We have it for the graduates and an undergraduate honor cord program. And then just last but not least, we offer scholarships and grants. We have a KNF Mildred Metz Scholarship for pre-licensure, KNF Nursing Excellence pre-licensure, and then a KNF Rural Nursing Scholarship. I think that is both pre-licensure and license.
It is. Just to go along with that, we built the learning management system. We've had it for almost 2 years now. We have 70 classes up. Also want to mention that we have lots of ways to communicate with you. We have e-news, which goes out twice a month, and it's only for members. And we have the special bulletin that goes out 8 times a month, and the Kentucky Nurse, which goes out 4 times a year. Did I say 8 times a month? I did not mean that. I meant 8 times a year. Please forgive me. Sherry, I could see that you were just about to have a stroke. No, 8 times a year. And it goes out on the months when we don't have our Kentucky Nurse out. The Kentucky Nurse is peer-reviewed and award-winning. And if you want to get something published, a good place to go to get it published is through the Kentucky Nurse. We have an editorial board and we have peer reviewers to get that done. We also have seven platforms for communication. So between the e-news twice a month, the special bulletin 8 times a year, the Kentucky Nurse 4 times a year, X, Blue Sky, TikTok, Instagram, I know I'm going to forget one, Facebook,
YouTube,
and
LinkedIn.
huh?
Did you say LinkedIn?
There you go. LinkedIn. Yeah. So we have 7. So what we're saying is we know that people get communication in different ways. So what we've tried to do is to make sure that we have it out there for whatever way you get your communication, that we have something for you. We've got it for you. Now, if you think of something else we need to belong to, somebody said to me, Sherry, we needed to be on Reddit. Do we need to be on Reddit?
I've not dabbled in that, but
Okay.
can look
Well,
into
it was a fleeting thought. So, don't waste any time on it. But that's how we got to TikTok, isn't it? As our members said, we needed to be on TikTok. So we investigated and got on TikTok. Okay. All right. Dr. Cecil.
All right. So we're just going to do a quick icebreaker real quick. So if you take your phones out, use the Mentimeter. You can go to menti.com, enter the code that's there, or you can just use your phone very quickly and capture it. I'll give you all a couple seconds. So just something fun, even though we are here for nurses and we want to be nurses. But if you weren't a nurse, what would you be? So this will make a little word cloud here. That's me. I would be Taylor Swift.
Sherry, I don't have my phone. Can you put in Perry Mason for me?
A male stripper. That must be Roger.
Oh, that must be Roger.
Pilot. I like that. So funny story. My son is a pilot for an airlines that I don't fly. A full-time beekeeper.
Oh, I know who that is.
Joanne, a lawyer.
No, not a lawyer, Perry Mason. Not just any old lawyer. I need to be Perry Mason. Oh,
A
excuse me.
photographer. I love that. I love it. Love it. A philanthropy if rich.
I
Yes.
get that. Yeah.
Yeah. Awesome.
So our legal nurse consulting friends, whoever wants to be a lawyer.
That's funny. Awesome. Good job, guys. I always love that question. And it's so funny because lawyer is always involved. And then it's always funny educator is. And I'm like, wait a minute, we're nurses. We're always educators, right? We're always educating about something. But I typically see that as well. So good job.
When I
Haven't
went
seen a
to
male
the-
stripper.
I love it. When I went in the Navy, I wanted to change my my MOS, and they said, "Well, what do you want to be?" I said, "I wanted to be a pilot," and they said, "Oh no, we got enough pilots. We need nurses." That's all you get.
That's funny. Awesome. Well, that was fun. Thank you all for participating.
Okay. All right. So one of the things that we like to talk about is some of the things that we do for advocacy. And mainly because on the advocacy front, the KNA, we marched in Washington and we marched in Kentucky so that the women's voting rights could be passed. We got it passed in Kentucky so it could get passed nationally. So, but KNA did that. So when we're talking about the KNA, we have a history to stand on, and we're continuing to do that. So our advocacy issues and some of the legislation I mentioned about the DCRIM bill, we also in 2023 got a workplace safety bill passed. And we also got a workforce bill passed that the Kentucky legislature just funded with $2.1 million. So when we got it passed, it was an unfunded mandate, but the legislature came through with some money so that we can support nurses and other healthcare providers to go into the healthcare workforce. This year, we have 4 priorities. We normally have 3 to 4 priorities, and it's the Governmental Affairs Cabinet that makes recommendations about what those priorities should be. That goes to the Board of Directors, and then the Board of Directors makes the final decision. So this year, our priorities are SANE nurses. We don't have enough. Renee, how many SANE nurses do we have in the state of Kentucky now?
I'm like 300 and something. I think we're just like slightly over it, but we did pass a bill today.
Did
Or
it
not
pass?
pass, but it was unanimous vote.
Wonderful.
Yeah, let me pull that up real quick.
Yeah, that's a bill that supports a position,
Trained nurse, yeah.
executive nurse for the SANE nurse program. And also, it also talked about some data collection. Is that the one?
So it was House Bill 134, which will expand the availability of sexual assault nurse examiners, which I have, across the Commonwealth so survivors won't have to travel far from home. It was Representative Rebecca Raymer from Morgantown. First learned about the Kentucky SANE access problem 2 years ago, and she's really been working to help hospitals become more SANE ready. And so, yeah, it was.
So it passed the House today?
Yes, it did. It'll go to the Interim Joint Committee on Health Services. The plan would be to the Interim Joint Committee on Health by December 1st. And it was unanimously approved. And so now it'll go to the House floor for consideration.
Oh, that is incredibly awesome.
Mm-hmm.
So some of the other things that we do okay, I was getting to the priorities. So SANE, school nurses, we are working towards a school nurse in every school all day, every day. Also safe staffing, and that includes workplace committees, as well as making the environment safe. And then last but not least is the image of nursing. We are working diligently on the image of nursing. Joanne, did I miss anything? No, I'm good. Okay, good.
You said
All right.
workplace safety, right?
I did.
Okay. I thought
Okay.
you did. And then I was like,
Did she say that?
it's on the top of my mind.
Very good. Right now, we're in legislative session, and with our government affairs cabinet, they are meeting weekly to review every bill that impacts nursing or healthcare. Every bill. So far, we have reviewed approximately 56 bills in the last 2 weeks, and we will continue to review them. And then they will make recommendations to the board on whether the KNA should support or not support those bills. We are doing our Nurses Day at the Capitol, February the 5th. If you haven't signed up, there's still room. It's going to be at Kentucky State University this year because the Capitol is under renovations. We have approximately 8 legislators who are going to be speaking to the group, and we have student nurses coming as well. And Roger's going to speak too. We have approximately 10 affiliates who are going to speak. Dina, you're speaking, right? Yes, very good. We have approximately 10 affiliates that are going to be speaking there as well. So we'll have a lot of information to share with nurses and nursing students about things that they can do to help with advocacy as we move forward. We have our Nurses Month in May, our Nurses Legislative and Engagement Program. How many of you guys have ever heard of such a thing? Nobody? Uh-oh, we have failed. Okay, here's the deal. We have been pairing a nurse with a legislator so that they develop a relationship so that when legislators want to know about nursing or healthcare, they make a call to us and we give them the skinny. Now, we start with having coffee or a peppermint stick together, not the same peppermint stick, but a peppermint stick together. But the whole idea is to pair every legislator with a nurse. We're really close. Well, I think we're at 126 today. There is education and training for the individuals who say yes. I said yes. And the person that I'm paired with is Representative Nemes. He has carried 3 bills for us, 2 of them across the finish line. And so the whole idea is to become their resource because most of them know nothing about healthcare. And if we don't give them information, they're going to make bad decisions. There are only 2 nurses in the legislature right now. And that means that there's 128 legislators who don't have enough knowledge to make a decision on a healthcare bill without us. So if you are not participating in the program, please let me know. We will get you paired up, get you educated up, and get you ready to go for the Nurse Legislator Engagement Program. Let's see. GAC, the Governmental Affairs Cabinet Retreat, is in July. And that is when the Governmental Affairs Cabinet listens to what our members say should be our priorities for the 2026 through 2027 year. We're on a fiscal year, which makes it really weird. So we're from July 1 of 2026 to June 30, 2027 will be our next fiscal year. Right now, we're in the 2025-2026 fiscal year, which ends June 30. We also have our leadership and advocacy conference is going to be at Frontier University on May 29th. It'll be all day. And we have an incredible speaker coming, a nurse legislator from North Carolina. How are we doing on time? Okay, I have gone too long. All right. So one of the reasons that we wanted to have this meeting is to see if any of you are interested in stepping up and being the Roger Cecil of the Western chapter. Roger has lots of fun. He gets to speak to lots of people and influence them to do the right thing. Don't you, Roger?
Yeah. What questions can we answer for you? Or what can
Yeah.
we help you all with?
And we want you to know you're not going to be on an island alone either. I think
Yeah.
we could pair you with a chapter leader that has been doing it maybe a little bit longer and help you with that, because we definitely don't want you to feel like you're on that island. You would have the support of any of us in the Kentucky Nurses Association, any of our board members. We pair you with somebody, a chapter leader. I know, Roger, you just took the role, but you've been Renee's right hand before, so you probably know more than most of the other chapter leaders. But
Just don't look behind the curtain. Pay no attention to the person behind the curtain, okay?
Well, and the other thing is most of the chapters have meetings at least quarterly. Like I mentioned, I think it's Reach that meets quarterly, but some of the other chapters meet monthly. And, some of them include some education, or they're sharing information about what the KNA is doing to support nurses, because a lot of people have no idea all the things we do to support nurses.
Delano, I just thinking about my position at Murray State, I don't think that this is something that I could commit to, but I would like to see Murray State nursing come on. I do think that if maybe this is something I could take back to the faculty and talk to them about, and maybe we could develop a plan. We've always been involved, but it seemed like after, I don't know, a period of time, we just struggled meeting, and we would meet at restaurants, or we would meet at KCTCS, or we would meet at Murray State, and we just have struggled. But I would really like the opportunity to go back and maybe talk to Christy Bell at KCTCS out of Paducah, and maybe Murray State folks get together and let's see what we can do to get ourselves back on track. I mean, it's too important to let it go, and I feel convicted to be a part of it. Just I need to figure all of that out.
I really appreciate that, Dina. And by the way, Dina is such a superstar that she had the Student of the Year in her cohort, right? And she brought a whole gaggle of people to Louisville for our gala to help support that student. It's pretty awesome, by the way. So I think that's a great idea. Are any of you interested in participating at a different level than being a member?
I mean, I'd certainly love to get more involved in KNA. I mean, I moved back here about 2 years ago, heavily involved with Tennessee Nurses Association. And
those are my people.
Would love to get more involved with Kentucky Nurses Association. It's just finding where I could be the most useful, I guess.
Well, Kurt is one of my favorite folk. He's a wonderful person. He's their me in Tennessee.
Yes. Yeah.
I would definitely be interested in getting involved too. This is my first meeting, so but yeah, I would definitely be interested in some different things. Maybe not head over the chapter right now, but something else that you guys might need. Sounds like you do a lot of great stuff, so I'd love to get involved.
I'm a little biased, but I think so. I'm so proud of the KNA. When we go to our national meetings, Joanne, what happens when we go to our national meetings?
they ask us how we do what we do.
Well, mainly because we are very small staff. At the KNA, we only have 4.3 FTEs to serve 93,000 nurses. But somehow we do the best we can do. Right, Sherry?
I tell people all the time, this board is a working board. We're not a board that just comes in and listens and tells people what to do, because we be the people that'll be doing it.
That's because there's nobody.
There's nobody else that'll do it. Working board.
Yeah, that is wonderful. So we are at 7:48. And do you guys have any questions about anything about the KNA or anything about chapter organization or anything like that? Okay.
So the
go ahead.
organization might be interested if Roger can tell us. I know it sounds like you have quite a few members, but you said like 30 do a lot of the work. Like, do you have like a vice? I don't know what you guys are called, like the head of the chapter, but do you have other people that really work together within that group?
So the chapter, you have the chair of the chapter and is like the president of the chapter, right? And then we have a secretary. So you have your chapter chair, your chapter secretary. You can fill in other roles as needed, right? So like we have an education chair. We have
Special
one who
events,
kind of
yeah.
do what?
Special events and Nightingale.
Yeah. Mhm.
Yeah.
And membership.
Yeah.
So we've got a few different, roles, I guess. And it really just depends on how big the chapter is, the engagement of the chapter. And I was gonna say I hear a lot of I want to be involved, but I don't want to be the chair. I promise you, it is not this huge undertaking that I do, hours and hours and hours a week, right? So I'll say from my experience this year coming in as the chair, I actually did a doodle poll and sent out to our membership because our meetings were monthly Mondays at noon. Who can make a noon call? Who can make a noon meeting on a Monday? Raise your hand. This is my sarcasm hand. It was really hard to make those meetings. So I sent out the poll and guess what? Well, Wednesday afternoons was by far the biggest result of my poll. So when do we do our meetings now? Not Mondays at noon. We do it Wednesday. We do the third Wednesday at 3 p.m. when most people have better availability. And we went from a monthly to a bi-monthly meeting just because there's usually not a lot of updates month to month. And because we have so many other ways of communicating that, whether it's email, it's the K&A, right? I mean, social medias, K&A app, we have all these other means of getting stuff out. So it's not a huge undertaking to be the chair. It's just taking the reins and running with it.
And I think to tap on to what Roger said is when the River City chapter, when I first joined the River City chapter, it was very much in its infancy phase. So it has progressed. So yes, we have a big chapter, but it's grown over many, many years. It definitely didn't start as big as it is now. You have to start small and just little by little add people as the word gets out. It's going to take time. And you may want to tap into another chapter. Like if another chapter is doing an education session, then you call that chapter chair and say, hey, we'd like to invite our chapter to be a part. Just if you don't have the resources, then find another chapter to combine with and do that with, because it does make a lot of sense not to recreate things that are already out there as well.
Joanne, you were talking about resources. I'd like to mention growth funds. Every chapter is allotted $500 a quarter or $2,000 a year to grow membership. And that can be anything. And as you can see, that River City does a lot of different things. I think one year, you guys, River City did a paint party. And
We've done paint parties. We've done appetizers at a local restaurant.
We did a
Yeah.
baseball game.
You did a baseball game. And that $500 can be used for anything to grow the membership, whether it's for new members, current members, students. I mean, it's your money. And all you do is fill out an application, tell me what kind of fun stuff you're going to do, or what type of activity, and say, Delano, send us money, and I write you a check.
And then you have to invite us to it.
Oh yeah, we got to be invited. Well, yeah, we got to be invited.
Not to mention, we did for several years, we did the picnic. Then our governor came.
Gosh, they were wonderful. Yeah. We
When are
invited.
you wanting this new chair or the new chair of the chapter to start?
Tomorrow. She's got a sense of humor.
You can just give me a holler and I'll get y'all set up.
No, in all honesty, as Dina said, it's been a while since Western has been doing anything. We have a chapter liaison. Her name is Nesia Thornton, and she has been working on a manual or a guide for chapter leaders by asking other chapter leaders what they do and how they do it and how they prioritize and things like that. She couldn't be with us tonight because she's sick. I hope she's listening, though. I don't see her listed here. But one of the things that she can do is also provide guidance to getting things done. No, she's not here. She's probably under the bed. But the key is, like Joanne said, you're not alone. Not even a little bit, unless you really want to be alone. But most people don't want to be alone.
Roger, I put my email in the chat if you want to touch base with me and we can see what we can get figured out.
And I would be happy to volunteer your first meeting or your first outing membership to come to Western and do like a meet and greet the KNA president and, president, I'll say Renee too, if she can make it, president-elect, and then Delano. Well, Renee travels right now a lot. I don't want to.
I know.
I don't want to commit if she can't, but maybe Delano can come ride with me, or I can ride with her or something, and we can come that way and meet some of the KNA members and meet them face to face, and maybe we could help recruit more into that chapter as well.
Especially if you have a picnic or appetizers at a place that have a little bit of wine. We certainly will be there. We certainly will. I'm just joking, sort of. But I mean, it's a great idea. The creativity, innovation, whatever you can think of. By the way, just to let you know that if you don't have the KNA 365 app, Jerry, get out your app. Show them. You can download it from your app store, whether it's a Android or an Apple, and all of the emails for your chapter are there. All you have to do, there you go, Sherry. All you have to do is download the app, go to the Western chapter, and all the emails are there. Also, for the chapter chairs, we send to you by the 15th of each month a list of all your members. What is the app? It's KNA 365, no spaces. And you just go there, download it, put in your email address, and you get on. But it's a wealth of information, because when we do things, even like the Nurses Day at the Capitol, we put all the information on the app. And we put our passwords on the app, because it's so safe. On the website, if you're going to be the chapter chair, we have an orientation for you already. And we can get maybe Roger to show you how to use the website and how to get to the app and how to get to all kinds of really, really cool things. And Sherry's the queen of app. She's the queen. Yeah, queen of app. What other questions do you have? We have 2 minutes left.
Can I ask a question that's just kind of for Sherry?
Yes, go right ahead.
Absolutely.
Do you guys provide a certificate of attendance?
Yes.
Okay. Sorry. I just wanted to ask if you could send it to me.
Absolutely.
Are you a member so that we have your
Yes.
email address? You are a member?
She's a student.
Yes.
She's a student.
That's wonderful. But we have student members. In fact, how many, Sherry, did you tell me we have 1,400 student members now? I mean, we are rocking it.
Yeah.
I can't hear you, Joanne.
Bailey, are you an honor court applicant?
Go, Joanne.
I'm not
But-
sure.
But
Well,
she's in the Western, so do they have it? That's
I don't know, but anybody can be an honor court. So what year are you, Bailey?
I'm in my sophomore year.
Well, you have plenty of time.
Absolutely.
Okay.
Sherry, can you send her the information on the honor court as well? Send her my contacts if she has questions as well. We're going to get
Thank you so much.
You and your friends need to become honor court applicants, and that way when you graduate, you can proudly display the honor cord with your cap and gown.
Okay,
Absolutely.
awesome. Thank you.
It's a pretty cool thing. Dina, if you have members who are your faculty, if they want to get an honor cord, we can work something out.
Okay.
So
Thank
they
you.
can wear it at graduation too. So that your students can say, what is that? Right? Although we want them to ask that question before graduation.
And I don't mind zooming in and talking about the honor cord. I'm kind of the honor cord person for the River City. So I'll be happy to, if any student or you have a group of students, usually sophomore, juniors, we usually don't catch them as freshmen because they're still drinking out of the fire hose. So usually juniors or seniors are when we capture them. If it's a 4-year degree, if it's a 2-year degree, it's usually second semester probably is when we talk to them. So just let me know. I'll be glad to speak to your students.
Sherry will help you with your student subscriber number. Okay, Bailey. All good questions for sure. By the way, LPNs can be members of the KNA. They also LPN students may be student members of the KNA as well. And they can also get honor cords. All nurses, we welcome all nurses. We are the welcoming committee for all nurses. So if you have nurses in your workplace that are LPNs, tell them that we are their voice and they should belong so they can have a voice too. Okay, we are straight up at 8:01. We thank you for your time. We really appreciate you all coming. I'm ecstatic about the number of people who came today. Makes me feel really good. Thank you, guys. Joanne, did you have some parting words?
No, I just wanted to say thank you again for taking the time out on this Thursday night before Stormageddon. That's what we're calling it, Stormageddon. And I'm on call this weekend, so I'll be in the hospital all weekend. Think of me when you all are nice, cozy, and I'm sleeping on an air mattress in my office.
Oh,
I have to fly to New Jersey on Sunday. So yay.
You're not going
you.
anywhere.
I'm not going
love
anywhere,
this.
I'm sure.
This weekend.
But if anybody has any questions, please don't hesitate to reach out to myself, Delanor, Renee, Sherry. I think Marsha's on here too. We're more than willing to help you in any way we can to keep you connected with the KNA. That is our goal, is to increase our membership and get more people involved in the Kentucky Nurses Association. Thank you.
And our email addresses and phone numbers are on the website, so you can find us. We want to be found.
Well, thank
Bye,
you all for
guys.
meeting with us.
Stay warm.
Thanks again, guys. Bye-bye.